Hello, good afternoon. Thanks for being here with us in this live Q&A. I'm Dr. Alejandro Gutierrez. This is the second live Q&A that we do. Hopefully we get better by time. I'm just arriving from the hospital. Today I did 2 gastric sleeves. Yesterday I did a revision bypass to bypass surgery. The patient had surgery like 5 years ago, but he regained all the weight because of pandemic and all that. So we did the surgery, and patient's doing great, and hopefully with good results in the future. So a little bit about me once again. So Dr. Gutierrez. One of MBC doctors. I've been in the company almost 10 years now, and so we're gonna start with the Q&As. So I have the first one. I had lumbar back surgery. Is it possible to place support under my legs during surgery? Okay. So yeah, a lot of patients that we do, they had previous knees, previous back surgeries, previous neck surgeries. So yes, we always put some help, some support. But in your case or in a specific case, we can do special support if needed. And obviously, well, in case of a gastric sleeve, the surgery is like 40-45 minutes, so it's very quick. And we take care of all the special things like your back. One question: I am allergic to opiates. Can your anesthesia team provide synthetic alternatives? Yeah, well, opioids are the most common use analgesic or painkillers in the present. But yeah, there's other options. And we can do, and if there's a specific type of medication that you're allergic to, so we can avoid doing that and do other options. Okay, if I am diabetic, do I need a specific A1C? This is hemoglobin, glucosylate hemoglobin to have surgery. Well, it's better if you have. Normally, here in the pre-ops. Your lab work and everything. Normally we do it, but it's always better that you bring one with you, so we can be aware or see your sugar levels in the past 3 months. So it's better if you bring it with you. Okay, another question. What's the difference between endoscopic and I imagine this is laparoscopic? Okay, so laparoscopic surgery, it's made through small incisions on the abdomen. So we place some special chokers so we can put the instruments inside. Very tiny incisions. The biggest one are half an inch. The other ones are a quarter of an inch, or a little bit less. And the endoscopic treatment, endoscopic is made by endoscopy. We call it upper GI endoscopy, so through the mouth. So it's not considered a surgery because it's just an endoscopy, and those could be the differences. I imagine that you mean for right now we have some treatments, bariatric treatments are made endoscopically. So those ones are under review. Some of them they are doing it all around the world with good results. So in the future, I hope. And I imagine we're going to have more endoscopic treatments as well. Will surgery help my diverticulitis? Yes, of course. We have to see the grade that you have. But yeah, losing weight and having a better diet and with metabolic effect of the surgery, it's going to help. So actually the treatment of diverticulitis is changing your eating habits, your diet, a little bit of exercise to lower the pressure inside the colon. So having the surgery is going to help with all of this. So yes, indeed. we will need to wear any kind of stomach band or waist band after surgery. This is a common question. If patients, they can have some abdominals band or elastic, we like to prevent any pressure on the abdomen after surgery. So it's no need. We only recommend for you to wear your stockings and to be moving around, but we don't recommend an abdominal compression. Is there any age limit? I'm going to be 65 this year with a BMI of 30. Back in the 1990, when the National Health Institute put the guidelines for bariatric surgery, the recommended age was from 15 years of age to 65. Last year, those guidelines changed. So we've seen that surgery benefits patients above that age, even 70s. So we have to take special care. They call it a frailty. So if you have comorbid diseases, so we have to take special care on that. But by the age, only by the age specific, we can go higher than 65. How long does the surgery take? So this is going to depend on the type of surgery. The most common one is gastric sleeve. Gastric sleeve takes like 45 minutes average. And then we have other surgeries. The gastric bypass takes like 2 hours. Revisional surgeries is going to take, depending on what we find, because every surgery is different. A little bit of scar tissue that we have to dissect, and it could take a little bit more. But those are the average time surgeries. Hello, I use a vape and was wondering if I will be okay to switch to zero nicotine in my vape. We recommend not to smoke or try to quit smoking right before surgery and right after, at least like 6 months, and then keep lowering. You can do it, but the safest thing will be to quit it, as well as caffeine, because this is gonna impair our oxygenation in the body, and for us to heal properly, we need proper oxygenation. So that's the recommendation. I had an open cut RNY in 2004, and I have gained 2,043 pounds. Okay, do you do revision surgery, and which one will you recommend? So in this case, well, it's been a while and it was open. In this case, we can see to do maybe a revision of Roux-en-Y. Just this is to lengthen the bypass portion of the intestine. Sometimes the gastric pouch increases. There are other types that from the gastric pouch and the original stomach, sometimes a common channel could be created. This is called a fistula. So food passes into the original stomach, so it's like the bypass is reversed. So your complete intestine is going to be absorbing calories. So in the revision surgery, we try to look all of those things, so we can revise and make it better. I have a BMI of 33. However, I do have GERD. Will I be able to consider to have the bypass even if my BMI is not 35 and above? You have to depend on different factors, your age, if you have any other diseases. But yeah, if your acid reflux is like on a daily basis, it's very bad, causing problems. If you have an upper GI and it's causing changes on your esophagus, so yeah, the gastric bypass it's a good option for you. Can you work on patients who have scleroderma? Yes, we can do. This is going to help a little bit. This is an autoimmune disease, so we cannot say that it's going to get cured, but losing weight, changing your eating habits, and with your proper medications, we can do it, and it's gonna get better. Okay, when can I try for pregnancy after surgery? Well, this is a common question. Normally, we recommend to wait at least a year after surgery, because with surgery, well, you're gonna be losing weight, but vitamins and minerals and protein, it's gonna get altered as well. So we recommend for you to keep taking your vitamins, minerals, and your body at first is gonna enter a state of malnutrition because you're changing quickly your eating habits. So, but this is temporary. If you keep eating properly, having your vitamins, minerals, your protein, so the body goes into a normal state of nutrition. But yeah, we recommend for you to wait a year. We have some patients that had the surgery and not planning it, and they get pregnant before. So we just recommend for them to get to your doctor and take special care on that, on the nutrition part. But yeah. Okay, question. I am having bad breath after surgery. Is this normal? It could be. It's gonna depend on the type of surgery that you did, and the eating habits that you have. And sometimes it can depend on what you're eating, and if the case that you have a gastric bypass. In the gastric bypass, we cut intestines. So sometimes, and the portion that we cut intestine, we call it the candy cane. Sometimes that candy cane it stretches or it's too big, so food can go into that intestine and remain a lot of time. So bacteria ferments that food and could cause bad breath. So we have to see what type of surgery they have and make some studies before. Okay. Okay. And how it is decided what time surgeries are done? I have surgery this Saturday. I imagine that if you're gonna go first or second, I imagine. So this is decided mostly by it could be because of the patients, their arrival, if they had their complete pre-op completed. So it depends on different factors. So we try you to be the first one or as soon as possible. So it depends on different factors, but you're gonna take all care of the patients at any time. Can I use an antidepressants or mood stabilizers after surgery? Yes, of course you can keep. That's gonna be indicated or followed by your doctor who's seeing you. But yeah, right after surgery, as you get discharged, we recommend for you to continue on your daily basis medications as well as antidepressants. Our goal, our plan is for you to be decreasing those medications or get rid of them, but your doctor back home is going to be the one who tells you when. But most of the patients, they lower the dose or they stop taking medications. No need. That's another question that's similar. Should I use an abdominal binder after surgery? No, we do not recommend. We want to avoid having like abdominal pressure and doing abdominal strengthening for our stomach to heal properly. So normally we don't recommend it. Just to keep moving around and having your liquids and your vitamins later on. Are hiccups common after sleep? Not that common, but some patients could have. So this could be because of a nerves that are close to the stomach. So if that hiccups are like on a daily basis or common, they can be uncomfortable. So in that case, you should see your doctor first, gastroenterologist, to see if there's medications or other thing that can be given. But it's not that common that most of the patients are going to have. Imagine on a daily basis, I'm speaking. This is a question, sleep versus bypass, which is better? So we cannot say that one is better than the other. Both of them are an excellent tool, but they are still a tool. Obviously, well, the bypass is, if you can imagine, a bigger push. It's going to be a bigger and long-term help, but this is more aggressive to your body, more invasive. So I tell my patients, if you're gonna use it properly, both are gonna feed you, are gonna do good on you. So it's gonna depend. If you have like a big BMI, diabetes that's unresponsive, or you're having like 2 to 3 medications to help with your sugar levels, so in that case we recommend a gastric bypass. If your BMI is low, young age, no diseases, so in that case we recommend a gastric sleeve. So at time that you're here and right before surgery, we talk and see your background and talk to you, and we recommend you the best surgery that we think is for you. So can I have a gel or acrylic nails on? You could. There are patients that could have, but normally when we're doing surgery, we need one finger or one nail, so we can be checking on your oxygen levels. So sometimes we have to take the nail off, or to remove it. So, but yeah, well, you can have it. The best thing is not, but if you want to look nicer, you can have those. It's been a few months from surgery and I have hit a weight stall. What can I do? Normally, so we were talking last Q&A. Normally, the first the first couple of months, you're gonna lose weight very fast. There's a stage that you plateau, your body plateaus, and do not keep losing weight. So in this case, it's always better to be helped by a nutritionist and by your doctor. So we can see if it's mostly a nutritional problem. Maybe by the time you eat a little bit faster, a little bit more, you can fit more. So maybe it could be that, maybe it could be the nutrition, or maybe it could be because of the surgery. So in that case, a revision will be a good option. Okay, when can I get plastic surgery? So this goes by the hand of the last surgery. So normally we recommend, but by the time that you're losing weight and then you stall, you plateau, that's the time that you can decide and have plastic surgery. Will we know before surgery? Will we know before the surgery is performed if we have a hernia? And if it will be repaired for added cost. Right before the surgery, we can tell if we do an upper GI endoscopy. In most of the patients, we find that when we're in surgery, when we're inside, some patients they bring with a prior endoscopy back from home. So in that case, we can tell. And some patients, because they don't have any symptoms, nothing, and we find it down the surgery. So, well, you're already asleep, so you cannot know until after surgery that we tell you. Normally, when we repair gastric hernia, hiatal hernia, we take pictures before and after the repairing, and we show it to you when you're awake, so you can see it. What is the weight limit you can carry after surgery? Asking due to having a backpack with a laptop to carry. Okay, so normally we have some lifting restrictions right after surgery. We recommend the first 3 weeks not to lift more than 15 pounds. And the first 2 months, not more than 30. So I think a backpack slightly with just a laptop, it won't be any problem. But yeah, we have a 15 pounds restriction. So this is what we want to avoid doing, is mostly heavy abdominal strengthening. What happened to the lap band? Why is it not popular anymore? Well, lap band was a good option back in the 90s, beginning of 2000s, because we didn't have the technology, the equipment, the expertise that we have right now. It was a good option, but it was the placement of a foreign body to create just like a little bit of restriction in the upper part of the stomach, and it worked. But now we have better options, and we seen at that time you thought that, well, we just put a foreign body, you lose a little bit of weight, and then we can take it out and your anatomy becomes normal back again. So we see that your body reacts to this foreign body, so it causes changes, scar tissue, and well, right now we have better options. And the results, if you compare lap band to gastric sleeve or gastric bypass, well, the later ones are way better and long term. So this is why most of the, and all around the world, lap bands it still have their indications, but are not that popular anymore. Hair loss. It's brutal at 4 months out. What do you suggest? Okay, so this is, we were talking a little bit that right after surgery, your body's gonna go into temporary malnutrition state. So part of it is that around 3 to 6 months, you're gonna see that your hair is gonna become, gonna start falling. Sometimes, this is not in every patient, depends, but this is temporarily. So if you keep eating proper way, taking care of your vitamins, your minerals, your protein, it's gonna grow back again. But for now, because your body was a big change, nutritionally talking, so this is the cause of it. But it will grow right back again, but just be taking special care on your nutrition. That's the best thing. Okay. I am concerned about dehydration. I currently drink 3 liters each day. Will I still be able to drink that amount of with a gastric sleeve? Not that amount as quick, because obviously you're gonna have your stomach's gonna be smaller, but you're gonna be able to drink. If you have a bottle of water, you can be taking small sips the whole time. And most of the patients, and like yourself, if you're taking proper liquids, not gonna get dehydrated. Most of the patients that get dehydrated is because they're having some troubles at first, because of a spasm, because of inflammation, not tolerating well liquids, having some nausea or vomiting. So in that case, they can get dehydrated. But in your case, if you're taking liquids, it won't be any problem. It's not gonna be that you're gonna be able to eat as much. Big gulps, it's gonna be small gulps, it's little by little, but not gonna get dehydrated. Okay. Should I be worried about post-op bruising? Normally you won't. This is obviously different on every surgery, every patient. The type of surgery, type of patient. If you're taking medications before surgery, patients that use aspirin or other medication could be affected. But no, most of the patients, they don't have bruising, or maybe a little bit just around the incisions. But it's not that much. It's just minor bruising, like in a regular surgery, I would say, or less, because this is laparoscopic. When does my body know when to stop losing weight? What if I lose too much weight? Okay, so normally it's very rare, and right now it's there are very few patients that go the other way to a malnutrition. So normally, we were talking in the other Q&A, your body is made to absorb calories, not to throw them away. So the body develops some mechanisms. So even with the gastric sleeve, even with gastric bypass, to keep absorbing calories. So that's why by time, sometimes you regain a little bit of weight or the weight. So if you're eating properly, if you're eating the right way, you're gonna be, your nutrition levels are gonna be good. We recommend for you to do a follow-up with your primary care doctor. So now and then they can be doing some blood work and checking your vitamin, minerals, hemoglobin levels, protein, just to make sure that your nutrition it's good. Okay, another question. I had my gallbladder removed in 2001. With some complications and have a big scar. Am I still okay to get a gastric sleeve? Yes, you can. obviously we're expecting a little bit more scar tissue, and we have to talk a little bit more deeply about the complications, what they did after. But yeah, we have a lot of patients that had a open gallbladder surgery, and some of them with complications, and we're still able to do the surgery without any problem. So yes. How long do I need to be off work? Normally we recommend, well, this is going to depend on the type of work that you do. Normally we recommend like a 2 to 3 weeks, but it's going to depend. Some patients that are on a desk job, not lifting heavy things, sometimes 2 weeks. Some patients are a week, they're returning to work, but normally we recommend a 2 to 3 week period, and then start slowly depending on how you feel. But most of the patients return back to work normally. Another question, and this is a common question: can I get a gastric sleeve if I had a tummy tuck? Yes, you can. There are a lot of patients that had tummy tuck previously. The only thing is that because they did a tummy tuck and your skin is not that stretchable as a normal or as previous as the tummy tuck, so we have a little bit more small space to work, but we'll still be able to do the surgery without any problem. So yes, you can have it. Why must we stop our hormonal patches before surgery? This is hormones or anti-birth pills. They can cause some problems in the blood clot or blood coagulation. So if you continue taking this, you can have more problems with blood clots. So that's why we recommend to stop taking it. Okay, another question. I'm scheduled for a mini bypass next week, but I get fairly regular heartburn. Do I have to switch to the full bypass, or will it be okay? I use Tums, but no medication. At time of surgery, right before, we're gonna do some questions about your daily acid reflux, what you eat, eating habits, the medication. If you use Tums and no medication, and that's okay, I could say that you can still have the mini bypass, but we have to get a little bit more involved and ask some more questions, and at the time to you if you can have the mini gastric bypass or the full. Okay, patient have feeling a little less stressed, so glad to be a little bit of help. Thank you. Okay. Is one surgery better for people who like spicy food? Okay, so not that I can say that one surgery is better than the other. Normally, we recommend for you to have good eating habits, and a lot of patients eat spicy food. So the only thing that, for example, if you had a gastric sleeve, and maybe you can have a little bit more heartburn after, but this is gonna depend on your eating habits. With the bypass, you can still have it a little bit less, but no, I would say that you can still be able to eat everything, but with moderation and I will take care of it. Okay, another question. My son is thinking about getting weight loss surgery with MSE. He's 6 feet and weight 600 pounds. Can he still be a candidate? Yes, he can. We still have to revise health questionnaire, but yeah, it's a lot of weight, and I imagine if not, he could develop some complications later on diseases. So yeah, surgery will definitely help him a lot. Okay, I'm on my second month post-op revision from sleep but having reflux. Okay, so this is what we were talking. Sometimes patients after sleep can develop a slightly or sometimes a moderate acid reflux. So this is, it could be maybe right now, see what your eating habits are, maybe be helped by a nutritionist, keep taking your medication, and and see, maybe this will help. And if the worst case scenario is that we will have to revise it into a gastric bypass. Okay. I read about some patients experiencing back pain from living a sedentary lifestyle prior. Are there certain exercises you can recommend to help alleviate the pain? I was in a car accident almost 2 years ago, and this is a huge reason I'm getting the surgery. I think the one better to give you some exercises are your doctor back home, but surgery definitely helps. It's gonna help losing weight, eating properly, eating healthier. So this is gonna help a lot. But exercises, well, your doctor is gonna be the one who gives you, because your specific pain or lesion has to be taken care by your proper doctor. Another question: will mini bypass cause constipations to be worse? At first, well, normally constipation could depend on different factors, but usually the same: losing weight, taking care of your eating habit. This is gonna help a lot. Some patients, or most of the patients at the first, they can have some constipation problem because they're changing their eating habits and they haven't the surgery. So, but this is temporarily. So, but I think in your case, constipation should get better after surgery. I took my son a long time to make this decision. He's 33. Hopefully mine goes smoothly so he can see a good example. He's otherwise healthy, but his joints are starting to really bother him. Thank you again. Okay, so yeah. So there's a study they did a couple of years ago in US, and they seen that when a member of the family does bariatric surgery, because they change their eating habits, lifestyle, and they seen some studies that the whole family lifestyle, eating habits, they get better, so they lose weight as well. Even their dogs, the mascots. So they did the study. So yeah, I know, and I hope that you become a good example for your whole family. And as at the end, this is for your health. This is why we do this. So live more and live healthier. Yeah. Another question: do you do gallbladder removal? Yes, we do. Yes. If you have some problems prior to the surgery, or some patient they want to take it out because they have some relatives that had the surgery as well, or problems with the gallbladder, yes, we can take the gallbladder at the same time as well. Another question: hi, currently I get lower back pain from simple things like washing dishes. I assume that has to do with me being overweight. Do you know if this will become better after surgery when I start to lose weight? Yes, obviously, and yes, losing weight is a big help. And this is the first: losing weight and your metabolic effect from the surgery. So these two combined are gonna help you with your health and with your back pain. Another question: my revision was from sleeve to bypass and having reflux 2 months out. Okay, so yeah, they have some patient. This is recently. So you keep taking your medication and your eating habit. If you continue with this, maybe an upper GI endoscopy will be good to see if there's other problems. And well, discarding all problems from endoscopic. So we'll see. Sometimes it is just temporarily and it gets better, but yeah, if you continue with that, the best thing is to do an endoscopy. Okay. Another question: which procedure is best for someone on a vegan diet? Okay, so this is a good question. So I think that it's gonna depend what type of vegan, but if you're completely vegan, maybe the less invasive, in this case, the gastric sleeve will be better. And as well, you keep in mind that you have to take proper care on your diet and will eat your protein, take your protein and your vitamins and minerals, and take special care on your diet and on your nutrition, but you can still be able to do it. Okay, so this is our last question of the day. Time goes fast, so thank you for your questions. This is, can you talk about taste bud changes after surgery? So this is not that common, but in some patients it develops. So this could be because of your part of the metabolic effect. So eating your what you eat. Normally, patients that are used to eat a lot of carbs, a lot of protein, a lot of fatty acids, your taste changes. So patients that eat a lot of carbs, your body is craving those carbs. So you want to have more sweet food. And right after that, you're gonna decrease all that. Your taste buds sometimes it take a time to get settled. So continue eating properly, and normally that should change by time. But if not, so we can have some studies. But yeah, normally the thing is that it will be getting better by time. Okay, so I think this is all the questions. So thank you very much for your time, your questions. Hopefully I've been a little bit of help, and hoping that do this again very soon, and to see you soon. So take care, and we'll see you soon. Thank you very much.